Heroin kills on a 9/11 scale every 3 weeks. New Jersey Governor Chris Christie setting a grim but very real picture of America's opioid crisis.
We have a 9/11 loss of death every 3 weeks. Every 3 weeks. That means we have 17 9/11s a year in this country.
So why are we still waiting for the Trump administration to officially declare the opioid crisis a national emergency? More than a month has gone by and still nothing, no official declaration. Senator Sherrod of my home state of Ohio, possibly the hardest hit state in the country by this heroin crisis, joins me now. Welcome, sir.
Carol, good to be back. Thank you.
Senator, why is the Trump administration dragging its feet when it comes to officially declaring the opioid crisis a national emergency?
I have no idea. I mean, I appreciate putting a governor on as the head of the commission, but we've asked the president to devote the resources of the federal government. Declaring an emergency is not just a speech from the president or a proclamation. It's using the whole, all the cross-agency cooperation in the federal government to address this. And Carol, it's your home state. You know what this has meant in Ohio. It's meant that more people have died in Ohio than any other state. I spoke with a man in Cincinnati. He and his daughter were part of a little roundtable I was doing in a clinic, and he said, my daughter's in her early 30s. She would not be alive today without Medicaid. So the threat by Mitch McConnell and the president to repeal the Affordable Care Act means 200,000 people right now who are getting insurance, who are getting treatment, 200,000 right now who are getting treatment in Ohio for opioid addiction are on Medicaid, and this bill will throw them off of their Medicaid over the next couple of years. You don't do that for people who are in the midst of treatment. So I'm asking the president to step forward on declaring this an emergency and to back off this I don't even inexplicable repeal of the Affordable Care Act. It simply won't work for our state.
I would suppose some people would say, well, President Trump is busy with other things, namely North Korea, right? And maybe he's just dragging his feet and taking his time because the opioid crisis doesn't rise to that level of national importance. Your thoughts?
Well, it does. It's the biggest, it rises to the level of the biggest public health crisis in our country since polio, when I was, I don't know, 5 years old. I mean, we've not seen anything in our country of this magnitude that's killing this many people in decades, and the president needs to devote those resources. But as I said, equally, maybe more importantly, is don't eliminate the Affordable Care Act and throw this many people off Medicaid. I mean, it's 200,000 people that are getting this treatment, and most of the people that are on Medicaid in my state, most of these people that were added under the Affordable Care Act that'll lose their insurance are people with jobs. They're making $8 and $10 and $12 an hour. And when I see a bunch of politicians who have health insurance paid for by the government willing to cast a vote to throw other people who are working in lower paid jobs than we're in, that they're willing to throw them off of their insurance, is just unconscionable.